Hello everyone, I'm Dr. Sivalingam Nalaya. In this lesson, we will take you through learning objectives and also discuss task analysis. In lesson 1, basically you will find these words time and again: aims, goals, learning objectives, learning outcomes. All these terms describe what learners should achieve as a result of their educational interactions. Learning is really a journey where the end point is made very clear. Learning objectives or learning instructions are observable and measurable behaviors exhibited by the learners. For example, at the end of this lesson, the learner should be able to be competent in performing a pap smear. That is a common statement that one should see in learning objectives. In practice, what is important is really what is the fitness for purpose in designing your learning objectives. Objectives, outcomes, and competencies are used interchangeably. The primary aim is to inform the learners what is to be achieved, inform teachers how learners can achieve the learning objectives and outcomes, what is the basis of assessment, and eventually the readiness for the industry, for the profession, whether the learner is competent, ethical, and acceptable, and be able to perform the tasks that he has been trained to do so. In medical practice, at least, and in many professionals, in professional education, there's a shift from instructional objectives to learning outcomes, because learning outcomes are more intuitive and user-friendly. They are broad statements. They illustrate authentic interactions and integration, especially in clinical practice, which we will discover soon. And it covers cognitive, psychomotor, and affective domains holistically rather than just focusing on one element of the learning process. Learning outcomes are written from being generic terms and to specific outcomes. Learning outcomes may be defined in more specific terms as in related to the clinical context, as one is learning in the wards or in the operating theater or in the clinic. We also aim in writing these objectives in relation to the level of learning, whether it's a very junior medical student, is he a middle rung professional, or is he a postgraduate student? So we need to individualize our teaching depending on the particular educational intervention that we are designing the learning for. Learning outcomes are really building blocks of any teaching or learning program. They ensure all aspects of program are linked. We're looking at the learning methods, the design of the learning methods, and of course evaluation and assessment so as to ensure that learning has taken place, and the quality assurance aspect of the whole learning process. It is useful to look at this diagram when we design learning outcomes. If you see in the immediate left, it is the intended learning outcomes of the lesson. But if you deliver forward, it should reflect on the intended learning outcomes of the unit and the intended learning outcomes of the course, the academic program or curriculum, which is in line with what the institution is actually trying to deliver in the entire professional education. Writing the learning outcomes will relate to one of the three domains described by Bloom in 1956, whether it's cognitive, psychomotor, or affective. They specify the intended end point of engagement in a given learning activity. They are written in future tense, use easily understood language, relate explicit statements of achievements, and always contain verbs, they are action words. Clearly indicate the nature and level of learning required for achievement. This is important with regards to the level of the learning the student is in. Avoid ambiguity or over complexity, and always resort to the famous SMART events. What is the role of the teacher? Clearly, he ensures that there is integration of each session with the whole program. He has the curriculum in line, in his mind. He facilitates the students in achieving the stated objectives, and clearly he will administer assessment, which may be formative or summative. And that is why learning objectives must be measurable and have observable behavior of the students. The aim is eventually at the end of this whole discussion on instructions, students should be able to pass all assessments reasonably and be deemed competent. So let's recap. You include the following learning objectives, say for a pap smear that is shown on the right. At the end of this session, the learner should be able to, if you refer to the figure 1, be able to insert a speculum into the vagina, and he will be able to insert the instruments required to do the pap smear. As in 2, then you use words that state specifically what the learner will be able to do. Demonstrate the application of the sperm or insertion of the speculum into the vagina. Demonstrate his ability to pass in the Ayer's spatula and the cervical brush as shown in figure 2, and be able to remove this specimen and transfer it to the liquid that is provided for samples.